Rituximab. It's an antibody therapy that can be given alone or in combination with chemotherapy. It's a monoclonal antibodies to the CD20 receptor expressed on the surface of B lymphocytes. It is used to treat non-Hodgkin's lymphoma, Hodgkin's lymphoma, chronic lymphocytic leukemias, and other conditions like rheumatoid arthritis. It's administered via an intravenous infusion, through a needle placed in a vein in your arm. Your infusion will take place at an infusion center. In preparation for administration, withdraw necessary amount of rituximab and dilute to a final concentration with normal saline, dextran 5%. Gently invert the bag to mix the solution. Do not shake, mix or dilute with other medications. Administer rituximab after hydration and before chemotherapy and after steroids. Patients are recommended to premedicate 30 minutes prior to administration with acetaminophen, an antihistamine, and methylprednisolone 100 mg for or equivalent glucocorticoid before the start of 4 infusion, as well as each antihyperuricemic therapy if there is a risk of tumor lysis syndrome. Emergency equipments and medications that should be immediately available during infusion. Epinephrine, antihistamines, corticosteroids. Side effects includes infusion-related reactions, hepatitis B virus reactivation, progressive multifocal leukoencephalopathy, tumor lysis syndrome, severe skin and mouth reactions, serious infections, heart problem, stomach and serious bowel problems that can lead to death, nausea and tiredness. Pregnancy and breastfeeding. The manufacturer recommends patients who may become pregnant use effective contraception during therapy and for 12 months following the last rituximab dose. Pregnancy considerations. Rituximab crosses the placenta and can be detected in the newborn. Also, rituximab is present in breast milk. Vaccination. Live vaccines should not be given before or during rituximab treatment. When using for the treatment of multiple sclerosis, avoid live attenuated vaccines in patients who currently receive or have recently discontinued rituximab. Consider using live attenuated vaccines only if risk of infection is high. Administer non-live vaccines at least 4 weeks prior to initiating a rituximab course of therapy. So again, the patient who's receiving rituximab shouldn't receive live vaccines. The response to some immunizations may be lower in some patients receiving rituximab since it has immunosuppression effect. It's recommended to administer COVID-19 vaccine 2 to 4 weeks prior to next scheduled dose of anti-CD20 therapy. Administer influenza vaccines 2 weeks prior to starting anti-CD20 therapy.